Antipsychotic drugs for schizophrenia, I would say, on average, do more good than harm. Although obviously there are people that end up on them inappropriately or end up on them for years or decades when they shouldn't. Antidepressants is perhaps slightly more contentious. They probably are overprescribed for relatively mild cases of depression, particularly by GPs, because they are probably trying to understand or allow for the GP's behaviour. They're in that kind of asthma inhaler situation where they can't do much else. And the overprescription of antidepressants is not related just to that medicalisation of distress, it's also related to a lack of availability of alternative approaches, including psychological and behavioural interventions for that kind of distress. So, yeah, I think you can say that the big picture, we do medicalise distress. In a way, that's what doctors do. We medicalise things. Sometimes that pays off, and I think we have to have a fine-grained or nuanced approach to the different situations in which that occurs. Well, I've taken both chlorpromazine and fluoxetine myself, and I can attest to their toxicity.
I've taken.
I would not recommend anyone take them unless they've got, strong psychotic beliefs or, are quite severely depressed.
David Healy gave me a dose of droperidol as part of an experiment at one time, and I had a hangover for a week. It was the most unpleasant experience.
Yeah, well, I only took them for a couple of days each, and I just felt very neurasthenic for the time I was taking them. Fortunately, I felt better almost within hours of stopping them. But yeah, they are strong drugs, and one shouldn't take them unless one has a good need of doing it. We don't routinely, as is sometimes misrepresented, I think, by some commentators, we don't park people on antipsychotic drugs for life, and I think very often, so it's up to my patients to remind me perhaps, but very often we will review whether or not they've been on antidepressants, or more likely antipsychotics, for a year or two, or 3 or 4 or 5, whether they would like to try and reduce the dose. If they want to, you should probably choose a relatively stress-free period of their life to do that. And if they can reduce them and they're fine. And if they can't, then just go back to the dose they were taking before, and it's probably fine as well. I think people don't appreciate that. I think many consultant psychiatrists have 200, 300, 400 patients on their books.
Which, from a psychologist's point of view, sounds like an incredible number.
It's a scary number, actually, and it's because and those are skewed towards the most ill people with psychosis as well. People in and out of hospital, perhaps in and out of other institutions, and so practice doesn't. You just don't have the time to not speaking for myself, but one in that kind of situation doesn't have the time that one would wish to give to individual patients, and it does become a bit like, are you taking the drugs? Good, right, we'll see you again in 6 or 12 months.